This is one of those things you don't think about until you're in the situation, and then you can't stop thinking about it.
A healthy person has a million wishes, but a sick person only has one.
When we're talking about why somebody should give to Hope Air, give me an example.
I don't want to say that my job is easy. Again, I've said that people find universal healthcare resonant, and we put the message in front of them about the need. All we do is take your dollar.
The gift of time.
Time spent with family, 1,600 kilometers and thousands of dollars away. This organization continues its proud legacy of funding every eligible travel request that comes in the door.
Welcome back to another episode of Open Skies. This is our second part of a two-part series here at Hope Air headquarters. I am with Jon Collins, Chief Development Officer for Hope Air. Jon, welcome to the pod.
Yeah, it's great to be here. Thanks for having me, Chris.
Excellent. Well, why don't we get into a little bit about your story and how you ended up here at Hope Air?
Yeah, I mean, I just found my way, I guess is the way to put it. So I've been working in charity most of my career, and really proud of the work that I've been doing, a lot of meaningful causes. But I didn't know anything about Hope Air, and frankly, I didn't know much about the issue that we serve. And that was the summer of 2021, and kind of just got a random job posting arrive in my inbox from a headhunter. Sometimes you ignore them and sometimes you read them. And for whatever reason, I read this one. And what I read about was a charity with a really unique story serving a really important niche in our universal healthcare landscape. And it just clicked with me. I'll share openly. I've got a mother who was managing cancer as a single mom when I was 15 years old in rural Nova Scotia. She didn't use Hope Air, but she used service through the Canadian Cancer Society that helped her get in and out of Halifax for her treatment. She wasn't driving at the time. And so it immediately stood out to me, the parallel to my mom's journey. I knew how much how important that service was to her, and just making sure that she actually pursued the care.
Right.
And so that made Hope Air quite compelling. I've got a young daughter who accesses services at Sick Kids here in Toronto, and I was literally holding her when I was looking at the job description, and I became aware in that moment of how fortunate we are, despite a diagnosis that she's managing pretty well, how fortunate we are to just drive to the hospital. And I had never thought about the people that couldn't, and I've been thinking about it ever since.
When I was talking to Mark earlier, a thought kept coming into my head that this is one of those things you don't think about until you're in the situation, and then you can't stop thinking about it. Then it becomes so ever present. So an amazing need being met here by Hope Air.
Yeah, and aware that you were speaking to Mark, I'm mindful of stealing one of his quotes, but he always says to us that a healthy person has a million wishes, but a sick person only has one.
Wow.
And I think if you're a sick person who either it's for yourself or your child, and you have the goal of getting healthy, but then you come to find out that treatment is 1,600 kilometers and thousands of dollars away, and there are a lot of people in this country that would be a game changer, like a stopper of treatment for. And
right.
It's precisely as you say. They're very focused on getting well, and we're grateful that what we can do helps them focus on that and not the what ifs or the how can I's or even just booking their own travel. We allow them to focus on what matters.
Wow. And in your role as Chief Development Officer, or Chief Fundraiser, if you will.
It is a little cleaner that way, yeah.
What is your role here at Hope Air? What do you do from day to day here?
Yeah, well, it is that, right? I raise the funds. We have some government support, but I raise the funds from individuals and private partners to help keep the machine going. So really, it's about telling our story in a way that connects with the person on the other end of the mic, or just the person on the other end of the email or in conversation. And we work hard to maintain relationships with a loyal group of funders that really get it. And then we spend a lot of time sending our message to those who might be like me several years ago and need to be enlightened on the issue. And
right.
We're just really fortunate that we can tell that story in a way that's resonant, and a way that Canadians who value our universal healthcare system can grasp. And that's what we do. I guess we tell stories of impact, and we tell stories of the people that we serve in a way that the donor likes to hear and feels motivated to support.
I know with a lot of charities, a lot of the bigger charities, you donate money. It's a great cause. but the sight line to where your money goes somewhat gets lost. You know you're helping and you know you need to help, but you don't have that direct sight line. This is one of those charities where that sight line is so ever present and it's such a clear message.
Yeah, I mean, it's exactly as you put it, right? And I don't want to say that my job is easy. Again, I've said that people find universal healthcare resonant, and we put the message in front of them about the need, and also, telling the story of impact is pretty straightforward. Our work is more complex than people might realize, with different airline vendors, with different travel partners, and other programs that we offer. But at the end of the day, all we're doing is taking somebody from a community far away to healthcare that they need and deserve.
Right.
And so to tell that story of this is patient X who lives in Timmins, Ontario, and their treatment, was 1,100 kilometers away, and their options were, insurmountable credit card debt, or in another person's case, canceling the appointment. All we do is take your dollar and buy an airline ticket or leverage that dollar with a donated partner or something of that nature. But all we do is take it, put somebody on a plane, take care of them while they're in their treatment city, and help them access the health care that they need. It's quite literal. And frankly, that's why I'm proud to do the work as well.
Right. And so for every dollar that Hope Air gets, how much of it goes directly to caring for the people who need care?
Yeah, it's a great question. And so we're proud of the straight line to impact that we have. And we're also proud that we run our operations quite efficiently. So the most direct answer is that for year 2024, it'll be 83 cents of every dollar that we spend goes direct to patient programming. And then the balance is fundraising support or some administration things, or premises rent, things of that
course.
nature.
Now, let's lift up some of the stories. So when we're talking about why somebody should give to Hope Air, give me an example. Give me an example of maybe your favorite patient story, or one that that really resonates with donors and resonates with people who are listening right now.
Yeah, I think there are so many stories that I could choose to tell you. And I think, speaking of resonance, what's great is that we support every medical condition. So if cancer is something that has meaning to you, we can tell you that story. If pediatrics is something important to you, then we're supporting a lot of children, about 25% of our flights.
25% of, what was it, 13,000 flights?
Of 13,000 flights.
Are children.
That's right.
Wow.
For a range of conditions, of course. And of course, it is the kids that stand out to me as a young father. And yeah, I guess that's the story that I'll tell you. So we were in Vancouver in the fall, and we actually had a patient come out and speak to some of our supporters at an event. She's from a town in remote northern BC, where she's settled, where she has a family, where home is a part of catharsis and part of healing, and nature is a part of really what's important to them as their wellness. And so she told that story about how they were driving some 14 hours on regular intervals to get to care, sleeping in cars, things of that nature. That's all powerful. But what was most powerful to me is that she told the story of finding out about Hope Air at this time of year, right around the holidays. And it wasn't that there were cost savings. It wasn't that they were getting their child the treatment that they needed for a rare neurological condition. It was that they get home on a plane and spend the holidays together and be home for Christmas instead of being at a hotel in Vancouver while she's, pursuing her treatment. And I just thought that was profound, right? So our work is about health access. Our work is about delivering better outcomes for people and hopefully helping them get healthy. But there's all those things that you don't think about, I guess, right? Those intangible pieces that we're putting families back together.
Right.
And that's what she spoke about. She said at that time, going through what they were going through, to just have a holiday meal together instead of driving back and forth to treatment was was profound for her. And it was profound for me when I heard about it.
The gift of time, if you will, right?
Yeah, exactly that. Again, time spent with family, but just while we're on it, it's also time spent at work, right? So, Hayne, if you're having to take the time to drive and you're a low-income family, which is by definition who we serve, those extra days back at work that you're not missing are just as important as some of the other things as well.
Right. So talk to me a little bit about, you said people who are either at the poverty line or low economic means. talk a little bit about that. Like the money goes to people who really need it in the community, right? Like driving back and forth, like you said, sleeping in cars.
Yeah, well, that's it. And we evaluate everything on a case by case basis. So there's no like defined number or financial means, that we
Right.
qualify people on. But we are focused on people in need. Um, there's a stat that we use in our fundraising that actually says that 50% of Canadian families tell us that they couldn't afford a sudden expense of $1,000 or more. And if you're taking a single trip for medical care, that's
That's easy.
at least the amount that you're going to spend, right? So we know that there's a huge amount of Canadian families that could benefit from this service, but we are focused on the people that need it most. So it's those families that are struggling to make ends meet otherwise, that are having to make decisions around putting food on a plate or paying rent for a given month. That's who we're focused on,
Right.
and really just alleviating that financial burden. I guess to elaborate, healthcare is provincial, so each province has different ways at looking at how they support this. And for people above a certain income threshold, a reimbursement program works pretty well, or getting a percentage back of your flight works well. For people, the niche of people that we serve, it's the inability to front it on a credit card, or again, most of our clients take multiple trips per year. So it's carrying, I don't know, $3,000 trips on your credit card, or trying to find the funds to ever pay that off. Those are the folks that we're focused on. And then for others, there are some programs that offer some support.
Wow. And when you talk about those trips for $3,000, multiple times, these are people who are not only having to deal with the financial burden and the travel, they're also sick or dealing with sick kids, or so it's not like a blue sky kind of travel situation.
Yeah, it's interesting that you mentioned that, because again, I've shared with you that, well, frankly, I knew very little about the world of aviation, and I've looked at the fringes of it since joining Hope Air, but I hadn't really thought about the issue either, right? And just to your point, when we think about travel, it's business or leisure, right? It's not this unique niche or this important service that exists, right? And now I look around the airport and I'm acutely aware that a percentage of people, especially on regional flights within this country, are traveling for something, well, much more needed, frankly, than my vacation or my trip to a meeting, right? And yeah, and it's not fun at the best of times, right? So we haven't put my 3-year-old on a plane yet, because my wife and I, as much as we love to travel, are a little bit anxious about navigating through that experience, right? And the families that we serve don't have the option. And to your point, they're managing the stress of that on top of the stress of it's specialized care that we deliver, so often a very challenging diagnosis with its own, I don't know, nuance, and the challenges of understanding that. Yeah, and the pressures of life on top of it, right? So the families that we serve, there's a whole mental health angle to their experience, and then I think to the support that we provide, again, by just getting them to where they need to go without all the questions about it.
Yeah. We had a previous podcast was the president of Encore for WestJet, and he talked about going to visit those regional bases, and he set a mission to go visit every single station that Encore flew to. And this process took him almost a year and a half to do, because of the lack of regular flights. Sometimes there'd only be a flight every second day, the remoteness of some of the locations. So somebody who works for an airline who's getting around had trouble getting to these remote destinations or more regional destinations. I couldn't imagine somebody who had to do that while navigating all the medical concerns, right? You talk about business, leisure, and now medical. That's like a third bucket of travel that a lot of people would never consider until they're there.
Yeah, and our healthcare system doesn't care how often Encore, flies into Terrace, BC, right? They have a cancellation, they offer you your specialist appointment, and they want you to be there, I don't know, tomorrow afternoon, right?
Right.
And so that's a limitation in terms of the logistics of our business. But to your point, if you're someone who can't afford the trip to begin with, and then you think, well, I've got to be 14 hours away in Vancouver or Toronto tomorrow morning, how am I going to get there? All kinds of questions. But then also, as you know, it's going to be the most expensive flight of your life, right? If you could plan that 3 months in advance,
Yeah.
it's a very different proposition than next week or tomorrow morning.
You're not on red tag deals looking for a last minute flight to Cancun.
Precisely, right? And of course, you'd mentioned WestJet, who's a great supporter of ours. Often we're able to travel in kind with them. They donate a significant number of flights to us. But it's an interesting part of our operations as well, is if we often work with last minute or at least short timeline travel based on the nature of our healthcare system, which means that our cost per ticket are quite a bit higher as well when we're booking on behalf of someone else.
Going into 2025, what are your goals for fundraising? How can people help? How best can people get involved?
Yeah, I appreciate you asking. I mean, our ambitions are quite high. So just to share context, in 2024, from fundraise sources, we'll raise about $4.7 million,
Wow.
which is up 60% year over year from 2023. And we're quite proud of that growth. But in a lot of cases, we might stop there. We'd just be proud and we'd aim to sustain that. But Hope Air's reality is that we're seeing more and more demand month over month, year over year, since really the end of the pandemic, right? So our goal is to keep up. I guess I have a budget target of a certain percentage growth over $4.7 million, but our goal is to make sure that this organization continues its proud legacy of funding every eligible travel request that comes in the door. And it's a weight that we wear every day. So I know you've given me the opportunity to share a donate link, and I should do that. But
Yeah.
truth is, I think I want the listener to understand that it's a profound challenge in front of us. We're ready to step up to the challenge, my team and I, but we've got to raise more and more money because we know that, jumping from 10,000 to 25,000 to 43,000 travel arrangements,
Right.
it's not stopping at 43K. There is more to do. So we've got great ambitions to just reach more people, have conversations like this to talk about the value of our work and generate more funds. And you can give by visiting hopeair.ca.
Excellent. Not only of the financial side, a lot of our listeners are people who make decisions for airlines or pilots themselves. So how can they help other than writing a check?
Yeah, again, I think we rely on great relationships with airlines across the country. I've mentioned WestJet, who's been with us really since day one of their charitable program,
Right.
and others that we're proud to work with as well. But certainly we like discounted flights, we like donated flights, and we know that they get it, right? The conversation that we're having around the infrequency of commercial service at certain airports in this country and how hard it is to get from point A to point B. We know that audience understands our work and the niche that we're filling. And so, please reach out around opportunities to take advantage of discounted fares or whatever that may look like, but also please just take a moment to think, I think, about what our patients are living with. And if you can tell one person about our work at Hope Air and how you can relate to it, I think that has a lot of value for us as well.
Well, this has been such an enlightening experience to lift up the stories here at Hope Air and really shed some light on, I think, a charity that a lot of people should be supporting because you never know when you're going to need to travel and when you're going to be sick or somebody you care about is going to be sick. So this has just been a fantastic opportunity. Thank you so much for having us, Jon.
I appreciate it. Thanks for letting me share the message.
Excellent. And we'll be back with more at the Open Skies podcast later on.